My name is Sylke Hoehnel. I'm a biotechnologist by background, and I did my doctoral studies at EPFL. I came to Switzerland for my studies first at ETH Zurich. I did my bachelor and master there, and then I really wanted to work with stem cells and more in interdisciplinary fields, and this is why I came to EPFL, because that only existed here.
So I'm Nathalie Brandenberg. I'm actually usually presenting myself as the local product, as I'm actually from the region, and there is very few people from the region on campus. And I studied life science in EPFL, and then progressed towards creating our own company together with Sylke.
Today we are working in a startup called Sun Bioscience. We created it in 2016.
The U actually is kind of one of the geometrical shape of our first technology. And actually, also the nice thing is that there is Sylke and Nathalie, so that fitted pretty well.
Yeah, so we are working on standardizing organoids. Organoids are small tissues that we grow from patient stem cells. So this is a very new thing and can have a lot of impact in the field of personalized medicine. They can be used to fine-tune treatments for patients before even the patient receives them. We work both with clinics to really give better treatments to patients and with pharma companies to find the right patients for drugs that are being developed.
And at the moment we are running a few pilots to explore how much these organoids can represent a disease in the lab and how can they be used for actually doing precision medicine and diagnosis.
Yeah, so a recent success was at the beginning of this year. We have a patient here in Lausanne at the CHUV who suffers from cystic fibrosis. She was not eligible for any treatment, so we created her organoids in our lab, and we tested all the different medications that are available to cystic fibrosis patients, not to her. We actually found one that works. Then together with the medical doctors and CHUV, we did a health insurance reimbursement request, which the health insurance accepted. So the patient ultimately got that treatment that we found working. And within 10 days, she recovered her declining lung function, which was at 60%, and it went back to 100%.
And the doctors were absolutely thrilled. So we really closed the loop from, really bench side to bedside, basically.
What we have done for one patient, we want to do it for many, many more. And not only in the area of cystic fibrosis, but also for other disease areas, for example, cancer.
We started at 2 with Sylke, the two of us in the lab, trying to figure out if our idea or if our vision would actually make sense.
Technology didn't exist, so we put our two heads together to develop it.
And then when we started testing it with very different, many different collaborators or inside the lab, we figured that it was really like a big advance. And now we are 20 people and we are really growing. We are almost doubling the team every year. So we aim at doing that for more than, 1 year.
I think we're very interchangeable, though very different people. I think we've been working together for 10 years. It just works.
My advice for future entrepreneurs is, if you have your gut feeling that you believe in what you're doing, really keep it.
Don't think twice. If you want to create a startup, you have an idea, you will never have a chance like this here in this environment to create something like that.
And then, of course, you'll have a mix of successes and failures. Believe in yourself and definitely embrace as much the failures than the successes.